Hello and welcome to Network. My name is Spumelele Zondi with your technology and social media news. We hope you are staying at home and keeping safe. Remember that if you want to be a part of our tech conversation, it's SABC Network. Now that's on Facebook, Twitter and Instagram. It's newsnetwork at sabc.co.za on email. This week, our Twitter poll is asking you if you think all universities in South Africa should follow the University of Johannesburg by giving their students 30 gigs of data to do their work from home. Results of that are coming up later in the program. But first, here's what's coming up tonight. We have details about different methods of collaborating as you are working from home. Video is a huge part of that. In our conversation, we go to the Luban Labs, where we talk about the role that universities' technology departments can play in the fight against COVID-19. As you continue to work from home and staying away from the streets, let's take a look at some of the methods of collaboration that you can use. In March, video conferencing platform Zoom saw a massive rise in users. They reported 200 million daily meeting participants. This is obviously because people are working from home. But Zoom has seen meetings being infiltrated. Here at home, Health Minister Zweli Mkhize has been using Zoom a bit to address the nation. A Zoom meeting between Youth Minister Maite Mashabane and journalists saw pornography appear. This was reported as a hacking. Zoom has said security vulnerabilities have picked up with the massive increase of users. And Zoom CEO Eric S. Iwan has said they're working on fixing this. But it's made some people use alternatives.
During these unprecedented times of the coronavirus, we actually were lucky enough to quickly implement our work from home policies, which are very comprehensive and fluid, which is very necessary at this time. And through these plans, we've been using digital platforms, which have really come through in helping us continue our work. Platforms such as Microsoft Teams, for instance.
It's an integrated collaboration platform that allows you to have chats, allows you to have video conferencing, audio meetings, file sharing and storage capabilities, and allowing people to actually do things like editing documents at the same time. For quite some time we've spoken about, or the world knows about, phishing attacks, and these are sorts of things that happened. We need to be making people aware of what to look out for.
Cisco says their WebEx platform also provides the kind of security that Zoom couldn't.
WebEx is a collaboration platform that offers you more than just video conferencing. It offers you an end-to-end encryption, meaning that the conversations that we are having from my device to your device is encrypted, and anything that we want to collaborate, the files, the whiteboards, and any sort of media sharing that we want to do is encrypted end-to-end, which is critically important to us. There is a free WebEx option, but what we've decided to offer is a premium service now in the light of the challenges that we face with COVID-19, just to encourage business connectivity.
One needs great connectivity to do this. Vodacom says they have that. For their new campaign, they used mobile phones for recordings and different communication tools to pull things together.
The entire commercial was shot through smartphones in South African homes. It was then edited from a music perspective, directing, etc. via WhatsApp, SMS, email, Skype, Zoom, etc.
In March, App Annie reported that video conferencing apps had been downloaded 62 million times. This will surely increase as more people figure out better ways of working remotely. So if you've been buying stuff online, chances are you've only been getting food deliveries. But there are those who feel that non-essential goods bought online should also get delivered as well. When President Cyril Ramaphosa put the country on lockdown, deliveries of goods bought online also stopped. Uber was allowed to deliver groceries, Mr. D was allowed to deliver medication, but nothing else. Some South Africans feel they'd like more to be delivered to them.
I can make a small example. Your kettle breaks and you go to your local Pick n Pay, Checkers or Spar. They're not going to sell you a kettle because it's not seen as an essential item. But sometimes you need to boil water to cook, or just a simple thing, a cup of tea. So if you can have the opportunity to now go and take a lot and order a kettle, I think it will just make life easier.
E-Commerce Forum Africa has written to government to request permission for these goods to be delivered.
If you pay for something online, you are paying online. You're paying by debit card or by credit card or by EFT, or even paying using mobile money. So there's no physical contact at all until delivery.
They say sale of some goods classified as non-essential, like warm clothes for winter, is necessary.
We feel that as the temperature drops, as we move into winter, it's really important that people should be able to buy things, winter clothes, heating, etc., etc. Again, as a sort of personal thing, my father-in-law, who's 85, at the beginning of the cold spell, took out his heater only to find that it wasn't working.
Despite this, there are people who say they've managed to get their orders delivered, like club DJ Simtronic, who'd bought a cell phone, for example.
I don't see a difference. I think if anything, they're actually quicker than usual, because they usually take about 3 working days. So I think maybe the backlog is not as bad as we assumed, or people just don't have money to order or whatever, but it was really quick. It was quicker than most time.
Government has, however, eased what one can be able to buy. Baby clothes can now be bought. Plumbers and electricians can now also be called in. Now, there's a new low-cost ventilator that's been developed at the Nelson Mandela University. This as South Africa's COVID-19 cases are expected to rise.
This is how this low-cost unit works, assisting breathing function. It pushes more air into the lungs. It is the brainchild of 4 engineers at the Nelson Mandela University. The ventilator meets the World Health Organization requirements. They prescribe the volume that must be delivered to the lungs, the minimum number of breaths per minute, and the inspiration-expiration ratio. The prototype was created in just 7 days.
So our market is effectively low-resource hospitals, like in Garankuwa, Soshanguve. So these are the markets we've effectively looked at, since a ventilator costs something north of 600,000 rands. So looking at how much these ambu bags cost, and then automating this bag will cost will get the cost around 5,000 rands.
Most COVID-19 deaths are caused by acute respiratory syndrome. In short, it means the lungs are unable to exchange oxygen and carbon dioxide sufficiently due to the fluid buildup. Treatment is mechanical ventilation. This device will also allow a mixture of oxygen and ambient air to be pumped into the lungs if required.
So we've developed the product with the advice of a pulmonologist and anesthesist, and we've looked at the World Health Organization standards. Our device is not clinically tested and approved yet, but we're gearing ourselves towards getting that approval and testing done. It's at this point in time, hopefully we won't need this device and the virus won't peak, but we are gearing ourselves towards if the virus peaks, we will be ready.
In the case of mass hospitalization, it is anticipated that certain countries may look to South Africa for assistance with medical equipment like ventilators.
So I think it's very important to note that by designing and supplying a cheaper and a more low-cost ventilator, you could save a lot more people. The biggest problem is that a lot of the rural communities that's in desperate need of medical services can't actually afford these services.
But doctors warn that ventilators must not be seen as a cure for the coronavirus and diseases linked to it. It is only a support mechanism while treatment is administered. More importantly, doctors say ventilators must be clinically tested and approved by the Department of Health.
In the intensive care unit, we make use of ventilators with advanced capabilities, and we need these capabilities when we ventilate patients with respiratory disease. Unfortunately, ventilating a patient with COVID is not the same as ventilating a patient with a drug overdose, for example. So a patient with a drug overdose has nothing inherently wrong with their lungs, and they tend to be easy to ventilate. Whereas a patient with COVID has lung disease, the patients are far more difficult to ventilate.
Projects like this fall under the National Ventilator Project, initiated by the Department of Trade and Industry. The aim is to produce 1,500 ventilators by the end of May, ramping it up to 10,000 units by the end of June. It is estimated that 80,000 ventilators will be required in South Africa should the pandemic reach the predicted peak levels.
It is SABC Network on Facebook, Twitter and Instagram. After the break, we chat about the role that universities' tech departments can play in the fight against COVID-19.
Individuals will not be allowed to leave their homes except under strictly controlled circumstances. All shops and businesses will be closed except for pharmacies, laboratories, banks, essential financial payment services. The nationwide lockdown is necessary to fundamentally disrupt the chain of transmission across society. I call on all of us, one and all, to play our part and our role as South Africans.
There will be a day when COVID-19 is a thing of the past.
Until then, our president has announced a national lockdown to save lives.
Unless you're an essential worker, stay at home. This is to protect you and others.
Stay at home, dulang haye, hlala ekhaya, play still.
Only leave home to seek medical care, go to the bank,
or to buy essential items like groceries or medicine.
You can still keep fit and healthy while at home.
But remember to take care of those who need it.
If you do need to leave home, keep your distance from other people and wash your hands regularly using soap or hand sanitizer. Let's keep each other safe. If you feel sick, go to your clinic, doctor or hospital.
Or phone the NICD hotline on 0800 029 999.
We can beat this.
We can beat this.
Count me in.
Count me in.
Count me in.
This epidemic will pass, but it is up to us to determine how long it will last.
It is SABC Network on Facebook, Twitter and Instagram. Welcome back. Let's go to the Durban University of Technology to speak about the role that universities can play in their technology departments when it comes to the fight against COVID-19. Ibrahim Asmal, thank you very much for being a part of our network. Maybe if you can start by telling us about the work that you guys are doing as Luban Labs.
The Luban workshop is commissioned and working with the USAF, which is University of South Africa, who the CEO is Professor Bawa, and we've been commissioned to help assist government in the fight against COVID-19. We have a number of different projects that are currently running. One of them, as you see, is the 3D printing lab. We are printing face shields and distributing them free of charge to hospitals, basically frontline medical workers, to basically protect them. There are also a number of other projects that DUT is involved in the Luban workshop and duty as a whole, which is the data collection, data analysis models that we are currently running, and we have two projects running at the moment. One is by Professor Jinabai, Sibia and Thakur, who are working on a data analysis package for epidemiology and how to government to quickly respond to hotspots by using the models that they have created. We also have Professor Monique Marks, who is part of the Urban Future Center, who is working very closely with eTequini Council and especially the Deputy Mayor in working with the homeless people and drug-related issues, where they are looking at how we're going to reduce the social and economic impact of COVID-19 with them. And that project, that they've been working tirelessly on that project as well. We're also looking at data analytics in a sense whereby we are using drones and working with implementing sensors on drones to pick up, because if you just heard the news last night, is that atmospheric conditions is one of the reasons why COVID-19 is different atmospheric conditions are causing COVID-19 to spread so rapidly. So we are looking at monitoring the atmosphere for one, for different types of temperature, humidity, gases, pollution levels, so that we can gather all this data, analyze this data, run an artificial intelligence in the background, and basically develop models on how we can best address the situation and reduce the impact of COVID-19.
Why do you think it's important for universities to get involved in the fight against COVID-19?
Firstly, I think the university has the resources, both infrastructure-wise and personnel-wise. We have professors and doctors in basically every field, and we can pool these resources together and be able to respond to situations much more quickly.
A question we've heard over and over again in the past is whether African universities can offer solutions to some of our problems.
With all your manufacturers being closed down, there is a huge shortage of PPE equipment. And labs like this, and even privateers, can get together with a 3D printer at home. If you have the right 3D printer and the resources that go with it, like the PLA, you'll be able to print things like face shields. And 3D printing has come a long way. We can now print, prototype a number of different projects, items very, very quickly. Like the face masks that we are printing. Our first prototype took 5.5 hours to print. We've redesigned, working with the mechanical engineering department, and we brought it right down to 24 minutes for the ones we are currently printing. Our new design will take between 10 and 12 minutes to print, and basically to fill the gap in industry right now, unavailability of products. And labs like this can be commissioned to basically fill that gap very, very quickly. But this is one of the challenges that we are addressing. We also look at other things like using drone technology. Just because we have the resources, both infrastructure-wise and personnel-wise, we are able to respond and develop and prototype items very, very quickly.
Where will these drones be deployed that you're talking about?
Well, it can be deployed anywhere and everywhere. It just depends where it is required and where we want to collect data from.
Is there any assistance that you need when you do work like this, or are you saying that you are the help?
No, we need a lot of assistance. We need collaboration between staff at the university itself. For example, if you look around here, we've got students working. We have people from mechanical engineering, electronic engineering, health sciences, all working together on different projects, or working together on a project to find a solution to a particular problem.
We've heard about other initiatives in different universities. For example, are there any chances or opportunities for collaboration in future?
Yes, I think collaborations has already started, and it's absolutely critical. Nobody can do it. I don't believe anybody can do it on their own. We can do it much more quicker, faster and cheaper if we collaborate with each other. And that's why we have USAF, who is coordinating all these efforts that are going across the country by the universities.
You also have a solidarity fund that has been started by the university. Can you tell us about that one?
Well, at duty last week at the Senex meeting, or the executive meeting, I decided to create a solidarity fund in order to help students and staff once we get back. And I think at the moment it's 5% of all management salary for the next 3 months will go towards this fund. And they've already picked up R1 million. The rest of us are asked to contribute voluntarily to this fund. That will help both the university, the students and the staff with any issues that might arise.
across the country we had thousands of reclaimers.
The lockdown has lived up to its name, closing all doors on everyone, including recyclers.
It has been a tough period for these men and women.
Let's just see what it is that we can do.
We managed to mobilize all of the food parcels.
Coronavirus spread internationally and has now hit the shores of South Africa. What are the chances that there'll be massive spread here at home?
The probability that we will get some local transmission is likely very high.
And if that happens, will the country be ready for that?
In terms of laboratory testing preparedness, we are prepared.
But who's at risk of contracting this illness?
Anyone who's within a very close proximity, and it's generally recognized to be less than a meter, might inhale or breathe in those little droplets that are then expelled by the infected person.
The most important question is, how can we prevent spread of the virus?
Washing hands with soap and water is still the most effective. Hand sanitizers are an option when you can't wash your hands or your hands are not visibly dirty.
CCMA offices around the country are closed as part of the national lockdown, but that hasn't stopped the flow of complaints from flooding in electronically.
I've literally lost all work.
Workers in the public sector, workers in the private sector, in this period need to ensure that their rights are protected.
The main devastation here is going to be economic devastation. Yes, the health issues are key and we must save our people, but we have to save jobs. We have to save the dignity of our people.
For the longest of time, Africa seemed immune to the coronavirus, but now reality is hitting home.
This pandemic has the potential to destroy all this and send us right back where we started decades ago.
Within this week, we plan to go around different areas to fumigate. Don't be afraid.
It is vital that we put in place a regional response to the pandemic.
There should be no doubts in our minds that we remain in real danger of devastating upsurges unless we take decisive, collaborative actions together.
It is SABC Network on Facebook, Twitter and Instagram. Let's find out how the tech industry has been responding to COVID-19.
The small Chilean beach enclave of Zapala has turned to high-tech drones to deliver medications, masks and hand sanitizer to its elderly in remote areas as the coronavirus continues its advance across the largely rural South American nation.
El día de mañana, si tenemos una persona en cuarentena obligatoria, ya tenemos la solución para poder llegar con medicamentos sin exponer a ningún funcionario, sin exponer a ningún miembro de la familia de la persona que esté con cuarentena obligatoria, y así creemos que vamos avanzando y vamos trabajando en conjunto.
The wealthy beach community has also used drones for ocean rescues and to monitor forest and brush fires. And now in Europe, a software system that allows for coronavirus contact tracing through people's mobile phones may be gaining traction in Europe. One of its coordinators says even European countries have formally signed up for the system, which tells a mobile phone user if they've been in proximity with a person who may be infected.
There are no problems of public liberty with this application as it's been conceptualized. None. No one will know anything. No one will have access to anything. And the only available information is that when you get in contact, sometimes without knowing, with a person who's tested positive, you will receive a notification that will tell you to get tested, and you can do whatever you want.
Startups in Germany, Italy, France and other countries are racing to develop apps based on PEPP-PT. More than 200 scientists and technologists are collaborating on the initiative. Germany says its contact tracing app will be ready in 3 to 4 weeks. And now in Belgium. Workers in the port of Antwerp will next month begin testing wristbands developed by a Belgian technology company that could help guarantee the social distancing required during the COVID-19 pandemic.
The functionality of the bracelet is very simple. When somebody wears the bracelet and comes too close to another wearer of the same bracelet, it starts to vibrate. And the only thing the wearer has to do is to go step back to ensure he's in a safe distance.
Rombit CEO John Beckelmans stresses that for data privacy reasons, the app is not designed to allow companies to track the locations of their workers. Devices merely communicate with each other, not with a central server or the internet.
As the University of Johannesburg has said that it's giving its students 30 gigs of data per student per month so they can be able to do their work from home. This week, our Twitter poll is asking you if you think other universities in South Africa should follow suit. 88% of respondents say yes, they should follow suit. 6% say no, and a further 6% say they don't know. It is SABC Network on Facebook, Twitter and Instagram. News Network at sabc.co.za on email. That's it. That's all we have for you. From me, Spumelele Zondi and the rest of the network team. Stay home and stay safe. Bye-bye.